A UN Special Rapporteur says Canada's healthcare services are excellent if you can access them. And he's calling for a special effort to improve mental health care in this country. Dainius Pūras was named by the UN to look into access to healthcare in different countries around the world, and his latest assignment has been in Canada at the invitation of the Canadian government. Today he presented some of his findings. Dainius Pūras joins me now in the studio. Welcome and thanks very much for coming in.
Thank you.
If we start with some of your observations and some of your findings, because this is an ongoing study, one of the things, you isolate several areas, and one of the things you say needs a lot more attention is something that's very near and dear to you, and that is mental health care in this country. What are your observations? What are the gaps in mental health care?
Well, Canada probably faces partly the global challenge for mental health, because only now it's recognized that mental health is a priority and should be parity between mental and physical health. But this is easier part. I mean, everybody agrees on this. With mental health is a little bit more complex situation because there is some crisis of mental health services globally. It looks like they have gone too far to use coercion and to use over-medicalized approaches. So the promise was that with the biomedical model we will solve mental health issues, but this did not happen. So now we have to apply more human rights-based approach and public health approach to this.
What about resources for mental health? Because a lot of people in this country have said that the mental healthcare system is the poor cousin of the main system. You make the difference, between physical health and mental health. That is underfunded. It's neglected.
Yes. So this is about reaching parity. That mental health deserves the same attention and the same resources as physical health, especially psychosocial interventions. There was much reliance on medications, and sometimes medications are used in excessive way. So now we are thinking globally that we should improve access to not some sophisticated psychotherapies, but to short but effective psychosocial interventions, and to go away from this legacy that mental health care psychiatry is supposed to use coercion, force.
So basic counseling and support services, basic human one-on-one.
Yes, community-based services adapted to the needs of local population and based on work, not necessarily many doctors, but nurses, social workers, and maybe some general community nurses. They may be trained effectively to do simple but effective interventions.
You've crossed the country, and another thing you've pointed to, and for many Canadians this would be obvious too, but you've pointed also to what you've discovered in terms of Indigenous Canadians, the Indigenous population of Canada, Indigenous people of Canada. You say that that is another obvious gap in health care and healthcare treatment in Canada.
Yes, there are many efforts, and I will commend them in the report. There is this political will, this reconciliation process, renewal of relationships, apology, but now there is a need of some innovative services so that Indigenous peoples are involved, because I could see some level still of mistrust. And this may be obstacle for providing effective health care. Of course, it's a lot of what is called social determinants of health, about housing, water. So health is not just about healthcare services, it's about good environment, physical, emotional, and Indigenous peoples deserve better access to all these important issues, so that their health is still, let's say, quite much worse. Many suicides, many cases of tuberculosis, and they are overrepresented in prisons. So and the overuse of drugs. So this is serious issues.
The other field, which was quite interesting, I was interested in your report, you also talk about the Canadian government's approach to drug-induced illness, in other words, drug overdose, drug abuse, and you had praise for the Canadian government in its approach to that. Explain that to us.
Yes, Canada in general is a human rights friendly country. Now when we globally face attack on human rights in general, Canada is committed to human rights, which is very important. Human rights are important to health, but also to other issues. So Canada is doing well with, let's say, sexual reproductive health rights, and Canada is showing good example to other countries that we cannot go on with criminalization and drug use, because war on drugs just caused a disaster. And so decriminalizing is moving to public health approach is a very good thing, and I could see in Vancouver, for example, the safe places for consumption of drugs and prevention of overdose. So this is part of good things, but more has to be done to address root causes of this opioid overdose crisis. The roots are, again, many roots are in social determinants, so that it's not only about helping these people who use drugs now, but to prevent this crisis.
So groups at high risk.
Yes.
You talk about the social determinants. So Canada has, we know, adopted, because of safe consumption sites, has adopted what's called the risk reduction or harm reduction policy. You see that as positive. You've got an international perspective. Is that on the increase internationally, or is that on the decrease?
Internationally, there's a huge resistance to change. It's a very political issue, and I know many former presidents who are on the side of decriminalization and legalization, but they are former presidents.
Yeah.
But when you are in power, it's so-called hot potato, which, you know, this issue. So Canada is really demonstrating political will to move away from punitive and repressive approaches, because it's against human rights, but it does not work. And so I will commend in my report Canada for doing this, also internationally raising this issue, but for good examples, but like in British Columbia, but it should be replicated through entire country, these good examples.
What does it mean? It's interesting that you mentioned that. There's often the former politicians who talk about harm reduction, but it's not current politicians. You're from Vilnius in Lithuania, in the Baltic states, in Europe and everything. Is it still a hard sell, harm reduction?
Oh, well, we have harm reduction. At the same time, we have quite a punitive legislation. So it's ongoing struggle all over the world. We have very sad development in the Philippines, and some other countries are not progressing, maybe even regressing. So my idea and one of goal of this report that to encourage Canada to improve, even with quite good situation, to improve and to show to other countries that public health approach and human rights approach just works if you apply it.
Well, Mr. Pūras, I thank you very much for coming in. Thanks for sharing your observations, and we'll wish you good luck in writing your final report. Thanks a lot.
Thank you.